All right, good evening, everybody. Thank you so much for being here. And I will just do a reminder to folks that are on our panel to please mute yourself so that we can go ahead and start the program. So I appreciate that. Thank you all so much for being here. It is Stand Against Racism. This is the first night of the next 4 or 5 days that we will be taking action in this space. I'm Debbie Pope, and I'm the CEO for the YWCA here in Boulder County. As you can see, our mission is to eliminate racism and empower women. And so before we get started this evening, we're so fortunate to be able to have a bilingual program this evening. And so one of the things we're going to do in a minute, but not right now, is that we are going to ask you to choose your preferred language. And so if you would like to hear the program in English, you'll see at the bottom of your screen that there's a little interpretation piece that you're going to see, and it will pop up in just a minute. You'll press on that, and then you'll see two options. You'll see off, English or Spanish. And you do need to pick English or Spanish to be able to hear in that channel. So it's really important to make sure that you go ahead and do that as soon as we let you know. Now, Kelly is going to share with us in Spanish those same instructions so we can make sure we get everybody set. So just give us a minute. So Kelly, could you go ahead, please, and share?
Muy buenas tardes a todos. Estamos así con mucho placer poder presentarles este taller, presentación en inglés y en español. Lo que vamos a hacer es permitir que escuchen en español o inglés, dependiendo de su preferencia, y la manera en que lo hacen van a ver un icono de un globo, como un mundito, al fondo que dice interpretación. Al hacer clic en ese botoncito, van a ver 3 selecciones: off, apagado, inglés o español. Entonces, marque el que le conviene o le parece lo más correcto para poder escuchar y entender toda la presentación. Vamos a hacer instrucciones ahorita y vamos a poder instalar la interpretación muy pronto. Muchas gracias y bienvenidos a todos.
Right. Okay, so we're going to go ahead, Robin. Robin's going to go ahead and get us set up so that we're going to turn on the interpretation piece, and then we will ask. We'll give everybody a moment to go ahead and go into your bottom row there to be able to pick English or Spanish. All right, and Robin, I will just let you know that I'm not seeing it as a co-host, so let me go ahead and stop share so I can see if, there we go. Perfect. All right.
All right, the language function should now be visible to everybody at the bottom of your screen.
Perfect. We'll give everybody just a moment as we're getting everybody in. And we will continue to put this in the chat for those who are joining a little bit later, just so everybody knows how to get there. So I know looks like we still have a few folks that are joining us just a little bit late. So again, just a reminder to go ahead, go to the bottom of the screen. You can press on the toggle that looks like sort of like a globe, and it will ask if you would like interpretation in English or Spanish. And so you pick your preference, but you do have to pick one of them. And I will ask, somebody's typing, so maybe if we could have folks just unmute for just a second. Fantastic, thank you. All right, so here's one of the things we want to just share with, of course, our panelists will be doing this as well, is that we will be speaking more slowly, and we are going to be trying our very best to clearly pronounce our words. So if you feel like it may feel like we're taking some time, this is why, so we can make sure that everybody can enjoy this as well. We have gone over the instructions for the language piece, so I'm hopeful that everybody is in the space that they need to be to be able to enjoy the program. So let me go ahead. We will go ahead and get started. Just a little bit of housekeeping. This is your production team this evening. So while you won't see them, they are magically behind the scenes here. So you'll see there's Karina Carell, Shakita Yarbrough, and Robin Hazlitt. And so Karina, who's right here, will actually be working in the chat. So if you have questions, then Karina will be posting in there and be able to answer your questions. And Shakita and Robin will also be able to work with any technical problems or challenges folks have. So if you do have a question or you're having challenges, please go ahead and put it in the chat so that we can make sure we get that taken care of. So thank you. And these three women have been incredible in helping to plan this event this evening as well. Before we get started, as I said, our mission is to eliminate racism and empower women. And that means that we work toward right relationships with Native people. In the words of the Right Relationship Boulder organization, we want to acknowledge that the land where we live today is the territory of the Hinonooai people. We honor Chief Left Hand, leader of the last Hinonooai band, to spend their winters in the Boulder Valley. Many Hinonooai people were massacred at Sand Creek, Colorado in 1864. In our daily lives, let us remember that the Boulder Valley is home to the Hinonooai people and to many other tribes that also camped, hunted, and traded here for centuries, and that Native people of many indigenous nations live here today. We also want to take a moment today, in just a second, we'll be taking a moment of silence as our community and our country has been going through so much right now, and recognizing, of course, those lives that were lost with the terrible tragedy here in Boulder, and with other mass shootings that have happened so recently across our country. And we also want to take a moment of silence for those who we have lost too early to COVID, hundreds of thousands of individuals this year, and also for those who have lost their lives due to the racism in our country and police brutality. So I'd like everyone just to take a moment of silence. Thank you. Well, this is the beginning of our National YWCA Stand Against Racism Week, and it's called From Declarations to Change, Addressing Racism as a Public Health Crisis. We are tonight a part of more than 117 other events taking place across the United States to further shine light and evoking action to disrupt and change racist structures and systems. Structural racism, as many of us know, plays a large role in determining the conditions in which people are born, grow, live, work, and age. These factors affect people's access to quality housing, education, food, transportation, political power, and other social determinants of health. Understanding and addressing systemic racism from this public health perspective is crucial to eliminating racial and ethnic inequities and to improving opportunity and well-being across communities. Our collective efforts can root out injustice. Together we can transform institutions and create a world that sees women, girls, and people of color the way we do, equal, powerful, and unstoppable. So many of you, thank you for just watching that short film, about a 10-minute film, really just summarizing the health inequities and environmental racism in particular, in the example that was given in what's called Cancer Alley in Louisiana. And some of you probably recognize this bottom picture. and it is the Suncor refinery in Commerce City. And it has been and continues to be at the center of major concerns about the pollution and unhealthy conditions it is creating for neighborhoods around it, most of which are still plagued by redlining from the 1930s. So I want to take a moment before we, of course, introduce our wonderful panelists. Today is Earth Day, and so we want to take a moment to talk about how climate change, environmental racism is also, we're seeing environmental racism and climate change in these neighborhoods that had been redlined. So as we get into our discussion, we'll be able to see how racist systems and structures have created major health inequities for communities of color. And according to Climate Safe Neighborhoods, racism and the impacts of climate change are directly linked to zip code. We heard that in the movie as well. The redlining practice from the 1930s that was graphed to show high risk and low risk areas. We'll show you that map in a second. And all high risk areas were identified as neighborhoods that were made up of non-white residents. And even high wealth neighborhoods that were predominantly Black during that redlining time were also redlined. And so there's a lot I know going on in this graphic, but this is actually an overlay to be able to see heat vulnerability index as laying it over where redlined and markings were for Denver. And this shows the relationship between historical practices of redlining, community infrastructure, and exposure to heat and flood risk in Denver. And so they really looked at this particular model, which was adopted, the methodology was adopted from NOAA, which is here in Boulder, as many of you know, really looked at these different areas. They looked at heat vulnerability index by looking at the impervious surface, so where there's a lot of concrete, water and things like that can absorb as well. They looked at tree canopy cover for shade, looking at land surface temperature, and then the households in poverty. And so there's I just picked two different neighborhoods. And so this particular neighborhood right here is from a area that was not redlined. It was in what was considered a desirable area during that, when that process was done. And you can see that the households in poverty in this area is 0%. And you see the heat vulnerability index is actually a negative 1.49. And the average land surface temperature is 94 degrees, and their tree canopy cover is about 15%. Now, if we go up to this next area here, this is in a traditionally redlined area. There's about 48% of the population here that lives in poverty. And look at the land surface temperature, 103 degrees, nearly 10 degrees higher than in that other neighborhood. And then looking at the impervious surface at 72%, and then having a heat vulnerability index of 2.49. I randomly picked out these neighborhoods, but I think that it demonstrates and ties into what we're talking about this evening, and just how many of these systems and structures impact everything in someone's life. And of course, what we're talking tonight about is health equity and how this impacts people's health. And so I am so pleased now to be able to introduce our incredible group of panelists this evening. Let me start with Thelma Craig. She's retired as the project administrator for the Disease Control and Environmental Epidemiology Division programs at the Colorado Department of Public Health and Environment. And she has served over 30 years in the public health sector as a health educator, disease control specialist, research analyst, and contract monitor. She brings over 25 years of experience serving in community organizations as health educator and public speaker. She is one of the founders and currently the chairman of the board of directors for the Colorado Black Health Collaborative. She currently manages the Tackling Mental in the Black Community Grant. She serves on the Planning Council for the Public Health Academy. She's a board member of Envision and Colorado LGBTQ Mental Health and Substance Use Disorder Initiative, and part of the Colorado Vaccination Task Force. and she has been honored with so many distinguished awards. Just one of them is from the Robert Wood Johnson Foundation and National Civic League for the 2016 Health Equity Award. Welcome, Thelma. Thank you so much for being with us tonight.
Thank you for inviting me.
Wonderful. And our next panelist is Elena Ronda, who's the Director of Wellness, Health, and Education Programs for El Centro AMISTAD. She is also a professional research assistant for the Renée Crown Wellness Institute here at CU Boulder. Elena is originally from Guadalajara, Mexico, where she completed her studies focused on clinical and social psychology. In the United States, she has worked for over 30 years, intentionally directing her mental health profession to families who are new immigrants to the United States. For the past 20 years, she has worked tirelessly to fulfill the mission of the compañeras and expand access and equity to educational and cultural programs. At El Centro AMISTAD, Elena is the Director of Equity and Education Programs. Thank you so much, Elena, for being here.
Thank you, Debbie, for this introduction. Thank you for inviting me. Muchas gracias.
Thank you. All right, Irene Blair is Professor and Chair of Psychology and Neuroscience at CU Boulder, specializing in research in stereotyping, prejudice, and discrimination research. She has her PhD from Yale University, and her research focuses on stereotyping, prejudice, and discrimination, particularly with regard to underlying subtle or implicit processes that underlie such events. She uses laboratory studies to isolate basic processes and field research to better understand how bias and discrimination operate in real-world settings. In recent years, her attention has been captured by the problem of disparities in healthcare and the extent to which social biases may contribute to the problem. She works with an interdisciplinary group of scientists and practitioners to better understand the role of social bias in primary care, emergency care, and specialty care. Irene, thank you so much for being with us this evening. And I know you were just teaching a class, so we really appreciate you switching gears so quickly to be with us this evening.
Thank you for having me. And I now realize that picture must be pre-COVID times.
Well, you look beautiful now, and the picture looks beautiful too. So I want to start off this evening by asking each of you to answer this question. What does health equity mean to you? And how does that meaning shift for different people in different communities? And so let me go ahead, Thelma, and let you start us off.
Okay, great question. Health equity means fairness, fairness in healthcare, fairness in the distribution of health information, opportunities so that people can be treated with respect, healthcare around treatment. Health equity means giving people what they need, to be as healthy as they can be, and not just giving everyone the same thing. For African Americans, health equity has not been achieved based on historical deprivation of what we need in these areas of socioeconomic status, racial injustice, systematic racism, and the stress that it brings, around housing, education, environmental circumstances. So health equity just has not been achieved in the Black community. And it means a lot to me, and that's really part of the work that I do. And our mission in our organization is to achieve health equity in Colorado's Black community.
Thank you so much for saying that is a full-packed definition, but it explains how complicated this is and how many pieces really are tied to it. Elena, let me ask you that same question again. What does health equity mean to you, and how does that meaning shift for different people in different communities?
Gracias. Lo que significa para mí equidad es cuando todos los integrantes de una comunidad tienen el acceso justo a la salud. Pero este significado cambia dependiendo de quiénes somos, cómo nos vemos, de dónde venimos. Y estamos inmersos en un sistema de supremacía blanca donde no hay espacios diseñados para el bienestar de los otros, de los demás. Y tomando en cuenta, por ejemplo, donde yo vivo, que yo vivo en la ciudad de Boulder, se puede decir que es una ciudad con mucha prosperidad, educación, universidades, incluso hasta budista, con tiendas de comida orgánica, con personas sanas, atléticas, deportistas. Está aquí Google y la expansión de viviendas, progreso y educación. Pero aquí en Boulder también las desigualdades son inmensas, son muchas. Se habla incluso, la gente no puede imaginarse que hay vecindarios que no hay agua potable, que las condiciones laborales de mi comunidad son sumamente injustas. El exceso de trabajos y los ingresos desproporcionados de lo que se gana también es muy injusto, sin tener acceso muchos de los trabajadores inmigrantes a un seguro médico u otros beneficios, aunque paguen impuestos. La vivienda es en condiciones sumamente inapropiadas y el ambiente de seguridad. Ser latino no es seguro, ser gente de color no es seguro, y tener acceso a lo que los demás tienen, tampoco eso es verdad. No hay el acceso a los alimentos saludables por el costo tan alto, las brechas en la educación, el cuidado de nuestros hijos. Se dicen, bueno, ahí están los recursos. Sí están los recursos, lo que no está es el acceso, porque no reflejan las necesidades de las personas que no viven con estos privilegios con los que vive Boulder. Entonces sigue habiendo barreras en idioma, en diseños, en el sentido de pertenencia, en el transporte, en el cuidado, en la segregación, incluso la segregación en el sistema escolar. Y estamos inmersos en este sistema de supremacía blanca donde no hay espacios diseñados para el bienestar de los demás. Gracias.
Yes, Elena, so much, and much that some of us do not see and think about. And I appreciate you bringing that to light. Irene, of course, you're a researcher here with us, and your studies have been in this space. How do you define it, and how do you see that different depending on the lens and the community?
My answer is going to end up being probably fairly similar, but to me, I was so excited when you asked about health equity. I mean, that just seemed like heaven, you know, like health equity. Wow, we never talk about health equity. We sometimes talk about access or equality, but actual equity. And so to me, in the resourced country that we live in, it means that all people receive the education, the medical care and support they need to achieve their wellness goals. It does not, as Thelma noted, mean offering the same thing to everyone or treating everyone the same, because people need different things. And it does mean working with each person or each community to get from where they are to where they want to be, right? It means expanding our minds and saying, hey, what are the possibilities? Where do you want to be? And how do we get you there? You know, I think this also means, of course, tearing down the systemic barriers to health that we know exist from centuries of racism, from colonialism, from sexism, and, you know, a variety of other thought and operational systems that are keeping people down and other people up. I think, speaking to the second part of your question, how the meaning of health equity varies across communities really is in terms, I think, of specific goals and pathways to health for those communities. So, you know, to reach their wellness goals, some communities need better grocery stores. Other communities need safer streets. Some communities need childcare. Other communities need to get rid of the poisons in their air and their water. So that's where I see it as differing, but I think the fundamental goal of health equity is similar across communities. Thank you.
Thank you, Irene. Well, thank you all. Really, the depth of your answer shows the experience you have and the work that you're doing in the community. So Thelma, we looked at some of the slides from Denver. We looked at those, those areas that were redlined, and we still see the, repercussions of that years later. So what are some of the most direct causes in Denver that you still see impacting health inequity? And what do you believe continues to perpetuate the state of health disparities today?
And I want to point out the redlining. I'm glad you showed that slide, because racial housing segregation, that really is a real root cause today, even now, because back in the early, in 5 points, Black people lived in 5 points early on. Redlining started occurring in the 1950s. And so what's still happening now, for instance, is most of the Black people, and it's really diverse now, lived in Montbello, in that Montbello Green Valley area. There's like 60,000 people living in that area, one grocery store. So food deserts. Food deserts is really a problem because people don't have access to healthy foods in a variety of stores. And so that really is still happening today. That housing segregation, which cause inequities. And so that Montbello Green Valley Ranch area, really is having challenges with that. Montbello is a fast food forest, so it's, people don't have access to healthy food. So, that's something that I see today. Historical issues, those kinds of historical issues that are happening today leads to mistrust in the healthcare system. Even the clinic areas, they don't have a lot of healthcare access out there. It's growing now and it's improving, because they moved the university, in that Northeast area, but access to healthcare. But because of those kinds of things, people are still living with mistrust. So Blacks in Colorado have high rates of in health insurance, but they're not using it. They're not showing up because they feel discriminated against in those systems. So that's another problem. Health insurance literacy, not knowing how to access, or not even being allowed or being comfortable or trusting enough to access those services because they do have insurance. So those are some of the things that are still happening. Health insurance literacy. Because across the nation, Blacks have insurance, like I said, they're not accessing it. It doesn't translate to access. So that's really still a problem. They just don't go in. So fear of discrimination, like I said, they often call our organization, people in the community call our organization, Colorado Black Health Collaborative, to find out where are the Black doctors, where are the doctors that look like them. And so they're still trying to address that fear of accessing that care. And so the pipeline program, we have a pipeline program where we try to encourage young people to enter into medical care so that we can have more Black doctors, so we can sort of eliminate that mistrust of the healthcare system. So those are some of the things that I still see happening now in this community, and we are trying to address.
Yeah, gosh. When you're talking about, especially when we're thinking about healthcare and visiting a doctor, Irene, to me, that just points to research that you've done. So can you share with us a little bit, as we're talking about how important it is what Thelma's talking about, to be able to trust your care provider for you not, for you to not sense those microaggressions and things that are coming out. So.
Yeah, and I think, maybe a place to start, and it's a little hard to know in this sort of setting because I don't know who our audience is and where people are at. So, I might start at maybe a basic level, and then in the questions we can get more in depth. But, I think it's really important to acknowledge that racism is a system. It's a system we live in, and it's a system that permeates everything. And you can't live in this system without that racism affecting you, all of us. So I can't walk around and say the system's racist, but I have nothing to do with it, right? That racism permeates our thoughts, our feelings, and our actions. And that's all of us in different ways, not always the same way, but in different ways. And so I've spent my career really looking at how this can occur, even when someone says, but that's not what I mean. I have very egalitarian values. I want to or do treat everyone the same. It's like, I understand that, and I believe that is truly from your heart what you want. but we live in this racist system. And so things happen that we don't intend. So, you know, in our research, we see that a healthcare provider can have every intention and every desire to give the best care to everyone that comes into their clinic, and yet they can communicate in ways that make a Black patient feel unwelcomed, stereotyped, and potentially disengage in that interaction, or respond in ways that let's just say it's a white provider because of you know, you know, again, a system that kind of put blinders and expectations, you know, doesn't understand what's going on and can lead to a worse interaction. Or we can talk about an intake nurse who, again, espouses egalitarian ideals, is trying to use all the data at their disposal, and yet is still interpreting a Black patient's complaint of pain as a less serious problem than the same complaint coming from a white patient. We know that this happens, and we know that it happens over and over again. We also know that implicit racial bias at the community level. So if we're measuring the implicit racial bias in one community versus another, the community where that bias is higher overall across all community members, we know that people of color living in those communities, their health is worse. You know, things aren't going so well for them. And so we know it's not just the healthcare system, right? And this makes sense because each of us only interacts with the healthcare system, at least for most of our lives, if we're fortunate, only occasionally. You know, and so something may happen in the healthcare system and that could be a problem. But what happens to me when I go to the grocery store, when I go to my child's school, when I'm waiting at the bus stop, when I'm driving down the street and I get pulled over, when I'm, you know, not invited to the neighborhood gathering, or, you know, the countless numerous things that occur that accumulate and affect people's health. So, you know, I think that we need to address implicit or subtle biases, certainly in healthcare, but I think equally and probably more important is addressing these biases in our communities.
Mm-hmm. Well, Irene, thank you. You just took a lot of research and you dissected it down for us to really be able to understand. Elena, you are such an incredible community activist here in Boulder County. And as I was listening to Irene, I was thinking about, you know, your focus around wellness, and how that isn't just about our, you know, our physical body, but about how we are emotionally, right? How we are in terms of all of these things that Irene was pointing to that are painful and hurtful. So, you know, what are you seeing in terms of some of the alarming health disparities in the Latinx community right now? And some of those may relate and some may be others that you can share with us.
Retomando todo lo que ha hablado Thelma e Irene, estoy completamente de acuerdo como lo han expresado. Y por ejemplo, en este bubble, en esta bomba, en esta esfera de lo que es Boulder, podemos ver que hay muchas inequidades y muchas disparidades en la salud, y sobre todo en la falta de acceso a un seguro médico, y que muchas de nuestras comunidades no han sido apoyadas en el aspecto de poder tener como fondos, los fondos que otra persona de aquí de los Estados Unidos puede tener, los fondos de estímulo, y entre otras barreras económicas. Entonces, todo esto que está pasando, y sobre todo ahora con COVID, ha causado mucho estrés, ha causado mucha incertidumbre, ha causado incluso tantas pérdidas de trabajo que la gente ha sido desplazada, porque Boulder es muy caro, y ahora más con estas corporaciones que han venido a instalarse aquí. Entonces, vemos que familias se han unido para vivir incluso en viviendas pequeñas, pero con con más personas en la vivienda, que hay más, ha habido más contagios, ha habido más estrés, depresión, y no es tan fácil ir a acceder a un lugar para hablar. La salud mental en este momento está hecha a un lado para vivir y para poder satisfacer las necesidades de mis hijos, de mi mamá, de mis abuelos y seguir trabajando. Pero si yo quisiera, si o alguien de nuestra comunidad quisiera acceder a un servicio de salud mental, bueno, también vemos las barreras, vemos que no hay confianza donde voy a ir, tengo mucho cuidado de lo que yo voy a decir, tengo mucho cuidado también si voy a ser juzgada por recibir un servicio de estos, ¿qué van a decir de mí? Puede que haya costos que ahorita no me puedo dar el privilegio de pagar. Puede que tengo que hacer una lista así de un intake para que me puedan ver y una lista de espera enorme. Puede que la persona que me toque para hablar sobre mi salud mental y mi bienestar, a lo mejor no sea completamente bilingüe o no sea bicultural. O sea, hay muchas barreras en las que nuestra gente está sufriendo secretamente por no poder acceder a estos servicios de ayuda emocional. Gracias.
Yeah, gosh. Elena, and of course you brought up, COVID, which is just created even more challenges, and it has really even brought a brighter light to these inequities because they didn't just start, and it really, I think I do want to play off of one thing you said so many wonderful, incredible things to think about, but one of that is about trauma, and it is about mental health and how we, that's a very, very important piece that we don't talk about a lot. And, Thelma, as you've been already seeing these health disparities with COVID-19, and we've seen sort of a light shown on that, what are you seeing in terms of what this has sort of done in terms of devastating impacts in the communities? And there's also at the same time so many other things going on in our country too, that are causing, I would think, great despair and lack of trust and vulnerability. So I know that's a loaded question.
That is a loaded question.
Let me let you tackle that.
Because we are dealing with two epidemics. I mean, really intensely right now. Early on, we saw high rates of the COVID infection and hospitalization and deaths in the Black community, high rates. Initially, there were no discussions nationally or locally about the disproportionate impact on the Black community. But later on, the Congressional Black Caucus and other groups encouraged the CDC, to really push for this, to really shed light on how it really is impacting the Black community. Everyone mentioned that this was not a surprise that Blacks were dying more, but nothing was being done about it to make sure that it didn't happen. They really were not focusing their attention on the Black community. And, we were on the front lines and working, and so we were exposed more, and it was just still that disproportionate, the health disparities, and the opportunities for Blacks to be tested, and even as the vaccine became available, there were no active preparations to ensure that Black people got in the front of the line, at least, to really try. I mean, you want to make sure everyone is treated, but they were really not making the effort for Blacks to get vaccinated. Systematic racism is embedded, in our government, in our public health systems. And so they just disregard the Black body this entire time during COVID. I think that it's starting to change, and we're starting to see, now that now I think people are scrambling, to make sure that the vaccine is given to the entire community. So, that was a challenge. And then, with that vaccine, and then we having all these epidemics, with the police policing and, the police brutality, and it's impacting, that's really affecting our mental health, and so it's just impounding in the Black community. The troubles continue to happen. So I just hope that that this is an opportunity, for us to shift and really start addressing the inequities. And so because the lights being shown, you know, intensely, you know, on what's happening in the Black community. So I hope this is an opportunity. You know, we gain some good things when we have tragedies and, you know, we have epidemics and pandemics. And so hopefully that this will allow us to really, you know, try to improve the health of all people.
Thank you, Thelma. Well said. Irene, I mean, there's so much trauma in that. I mean, I'm just thinking about how heavy that all is. And so then I'm thinking about, okay, you're going to a doctor. So what Elena was even talking about, you know, trust, or even when we're thinking about mental health and accessing that. So how do you believe the healthcare system, maybe even not meaning to, is contributing to this trauma? And then how is racial bias and discrimination showing up in the doctor's office? And you gave us some examples too, but I mean, as we're putting this all together, it may actually be creating more angst and more trauma.
Yeah, well, I did want to just follow up on something that Thelma said around, you know, the systemic barriers, and going back to comments that we all made earlier about what is health equity. It's meeting people where they're at and getting them what they need for wellness. And so saying that, well, the main clinic has appointments for vaccines, everyone has equal access to sign up for them, is not good enough when people in some neighborhoods have to take 2 or 3 buses to get to that clinic, and they got to find childcare to get to that clinic. And then when they can't do it, you know, the conversation is around that group's health, you know, or vaccine hesitancy, rather than why can we not bring the vaccines to where the people are who need it. And when I look at the numbers for, trying to think if this was for Boulder County or for Colorado in general, I think it was Boulder County. And, you know, you look at the percentages of people in different ethnic racial groups who are getting the vaccine, you know, and again, as Elena's pointing out, this isn't a wealthy county overall. We're seeing huge disparities there. And so, you know, why is it that when we look at the, you know, white members of our community, you know, vaccine rates, you know, I think we're at whatever it is, 60% or something, maybe for at least one vaccine or higher. But among our Black members of our community, I think it's down like in the 30s as percent of population. I mean, you know, weighted for population. And so, yeah, I think that is a problem. And then it gets really tricky, right, to shed light on the problems, because it is traumatizing to get this over and over and over and over and over again. You know, that I you know, talk with my students about, you know, that there is a cost to social justice work, because you have to acknowledge how unjust it is. Right. And you have to see it over and over again. And you have to see how that's decimating your own people and targeted toward yourself. And that is extremely difficult to do. In terms of, you know, how this might happen specifically in healthcare setting, you know, I feel like I'm not the right person to speak to that. And I don't know that researchers or the research we've done can speak to that, because again, I'm going to talk about that, you know, our research exists in a racist system. And so what I go looking for when I'm saying, okay, well, let me take let's say a videotape, 50 clinic visits with white patients and 50 clinic visits with Black patients. And I review these videotapes and I say, I don't see anything different. Looks like everyone's being treated the same. You know, well, what am I looking for? What am I trained to look for? How do I know what that person's experience is on the inside, given, again, the history and the social context? And it's not an easy thing to tease out. So even if I go to someone and say, hey, what's your experience like? You know, often we'll get, it's fine. You know, people don't want to critique the system often. And in my mind, I think, well, you know, if I lived in a war-torn area and you came and asked me one day after months of this, how are you doing? I'd be like, I'm fine, it's fine. It's sort of what I'm used to. But that's not getting at what is really going on, and how can we make it better again so that we can get, you know, optimal wellness for everyone.
Yeah. Elena, I know you are such a cultural broker in our community, and really, as we're looking at vaccinations, what are you seeing is working in terms of getting that into communities, especially as we look at our Latinx community? And then what are you seeing that's still a big barrier and challenge? So maybe trying to find some things that maybe we can build upon, but also the things that we need to solve and are showing up as we're looking at this vaccination process.
Ha sido un reto muy grande para nuestra comunidad ahora con COVID, y quiero decir que, bueno, antes de COVID y ahora las inequidades existen, pero con COVID se vinieron a amplificar y fueron más visibles y más tangibles estas inequidades. Al principio de cuando empieza COVID, fue muy difícil incluso para nuestra comunidad hacer citas y tener los resultados rápido para saber si podían regresar a trabajar. A veces tenían que esperar más de una semana o dos para poder decir, no lo tengo, quiero seguir trabajando. Hubo personas que por miedo a dejar el trabajo seguían trabajando sintiéndose mal. Entonces, esta desproporción de personas que no tienen el acceso al seguro médico, a ir más fácilmente a unas pruebas, fue un reto bien grande, y sigue siendo y va a seguir siendo este reto. En las fases de vacunación, por ejemplo, para poder acceder a una clínica de equidad, después de que ya estaban las clínicas disponibles, para el Centro AMISTAD y para Boulder, les tomó 2 meses para concretar la primera clínica. Afortunadamente, ahora tenemos clínicas donde nuestras propias promotoras y otras organizaciones están apoyando para que vayan a un espacio seguro y que les estén esperando ahí. Por ejemplo, quiero decir algo de porcentaje que está pasando. En el condado de Boulder, la comunidad Latinx es del 14%, más o menos, pero el número de casos de COVID en ese 14% son el 32%. Hospitalizaciones el 38%. El número de muertes el 17.9%. Entonces, a diferencia, o sea, la comunidad latina, la comunidad de habla hispana, estamos vacunados ya el 28%, mientras la comunidad blanca es el 58%. Entonces, estamos viendo siempre esa desproporción en el acceso. La recuperación para nuestra comunidad va a tardar años, a diferencia de los privilegios que otras personas por su raza están teniendo, y sobre todo las ayudas de este sistema, que es un sistema pensado para blancos en beneficio para ellos mismos, porque los sistemas no están diseñados para la gente de color. Creo que contesté a lo que me preguntaste.
You did, and you dove deeper, which I appreciate, Elena, especially as we're looking at Boulder County specifically. So thank you for also lifting up the percentages here for the Latinx community, because that has been very evident from the beginning, those disparities. I do want to give the audience a moment to go into the Q&A. So please don't go into the chat, but go into the Q&A at the bottom of your screen. And this is really your opportunity to ask questions. And so as we're doing that, we have about 9 minutes with these incredible women. So I know it's not nearly enough time, but please feel free to put your questions in there, and then we'll go ahead and try to get those answered as they come in. So here's a question coming in. Many of these problems seem so large and complex. that it's easy to feel powerless, overwhelmed, and discouraged. What can we do at an individual level to push for change to help address these systemic barriers, whether that's health inequity, food deserts, things like that? Elena, let me start with you.
Bueno, primero quisiera saber de qué raza es la persona que está diciendo eso para saber qué es el privilegio que tiene para hacer, cómo va a usar su voz y su poder. Y no sé si es una persona blanca que quiere saber qué hacer más. Y yo siento que en este momento lo que nos ayudaría es hablar sobre nuestros propios privilegios, ver los espacios que estamos tomando para dar espacio a la gente que no tiene esos mismos privilegios. Y también hablar y recapacitar más sobre lo que quiere ser un aliado, porque es fácil decir, yo quiero ser un aliado, yo soy aliada, yo tengo amigos blancos, yo tengo amigos negros, yo no veo colores, eso no sirve para nada. Lo que en este momento significa es hacer las acciones, tener una postura, presentarse tal cual, tener esos círculos entre ellos mismos para entonces saber y reconocer el privilegio que se tiene ante todo lo que nos está pasando a todos los demás. Y yo creo que también saber identificar, aparte de su poder, las microagresiones, saber interrumpir y estar disponible en hacerse a un lado, porque hay espacios que es bien difícil para nosotros como inmigrantes, como personas de color, a ir hacia ellos. Aunque tengamos la capacidad, las personas que toman las decisiones siguen siendo las personas blancas y poniendo en posiciones, en lugares donde incluso deben de estar de gente de color. Hay que ver todo eso, hay que señalarlo y hay que expresarlo y tener una posición, claro. Gracias.
Thanks, Elena. Thelma, this is such an important question about action and how to take action that's helpful and not hurtful. I think from Elena's right, how are we good allies, especially for those of us who have privilege?
Good question. Yes, I think being a good ally really is about gaining understanding, but also examining your own implicit bias, because we have implicit bias, all of us do, that we're not aware of. And if you're examining those things when you go out into the world or even in your family, you can speak of a voice of truth, and giving your family members understanding, your community, your church, your agencies where you work, if you examine yourself first. So I said, gaining a full understanding and examining yourself and your biases, I think that frees you up so that you can participate and you can contribute, in the political arena, in agencies, and really looking at what is happening around you. You can approach those things, with a clear eye and a consciousness, so I think examining yourself for your own implicit bias, and we can all do that. But I think that in this racial inequities, I think that people really need to take a real look at themselves first. And then once they do that, I think they can contribute more, and then voice and then speak up, then engage in conversations, so you can change the narrative about how people provide services to people, and then identifying resources that can help your community. And you can do that in so many ways, in volunteerism and, and financially supporting organizations that are doing the work, but really I think it's starting with yourself, and examining yourself. And there's some tests you can take online to examine your own implicit bias about things, but having the conversation, and reaching out to other people of color who may be having challenges in those arenas and sort of get their input on how to help. But I think the first step too, I think for people to look at themselves, so they can, be free and have a conscience about how they can help. So I don't want to stay, I know we don't have a lot of time, but I can go on and on about that. But and when you examine yourself, you're asking questions of yourself, but you're also asking questions of people in the community who are facing barriers and challenges.
Yeah, so true. And I think, of course, an important part of that is, yes, these things seem very complex, but we have to keep moving forward. So
Yeah.
taking no action is not an option, right, for us to be able to solve this. So yeah. Okay, we have one last question here. Do you feel that the current administration in Washington will make true changes in health equity? I know that's a big question to answer. So maybe if you could do your best to just give a quick summary of your thoughts so far and what you're seeing.
You asking me?
Yeah,
Yeah.
start, Thelma.
Yes, I do, because we have to have hope. And I've seen some action that they've taken already where they really are concerned about the people, you know, because this has really been a tough year for people financially, you know, economically, you know, so in health, you know, in the health system. And so I see this current administration really trying to make some changes, you know, and I know, and it's difficult because barriers are always coming around, but I really do think in this climate of what's happening, you know, in the criminal justice system, you know, in the pandemic of racial injustice and inequalities and policing, you know, I think this administration is trying to take steps to do that. And I think really with the COVID package, the care package, you know, named CARE, I think that they really are caring about that. And that's what's important. And really trying to be fair and bring everybody together and really trying to and be inclusive around getting help for everyone. So I think so.
Well, it is the most diverse cabinet with the most perspective we've ever seen. So that is to Elena's point, right? We've got to make sure those voices are there. Elena, I just want to follow up on that, because as we think about access to these packages, right? To the care packages, to stimulus packages, there's some barriers there though for the Latinx community, from what I'm hearing from you, you know, so if you're an immigrant, you know, what challenges are we facing in terms of people being able to actually get these benefits and services?
Bueno, primero de hecho que no los van a tener, porque especialmente personas que no somos de este país, que no nacimos en este país, no vamos a tener este privilegio, sobre todo por el aspecto de documentación. Entonces, no vamos a tener este acceso de ayuda, aunque trabajemos más y contribuyamos y seguimos pagando los impuestos. Nosotros pagamos impuestos, pero no tenemos de esto de regreso. Quiero decir también que sobre lo que contestó Thelma, sí, esta administración sí se ve mucho mejor, incluso, ¿verdad? Comparándola con la administración pasada. Y otra vez, necesitamos la representación de los latinos. Y sí, ahora hay más diversidad, pero necesitamos más latinos y sobre todo también locales. Afortunadamente tenemos ahora, por ejemplo, la primera mujer que es, ¿cómo se llama? Comisionada, Marta, que es comisionada. ¿Por qué hasta ahora? Pero ya es algo, ¿verdad? Yo también quiero ver que tenemos esperanza de que las cosas están cambiando y que necesitamos más espacios donde nosotros mismos, sabiendo nuestras propias necesidades, trabajemos bajo nuestras propias necesidades, ayudando y apoyando más a nuestra propia comunidad. Gracias.
Thank you. Oh, we are at 6:30. There's not enough time for this discussion tonight, but what I will say is I'm going to give everybody quickly time in the chat. I want you to share how you're going to stand against racism. What action are you going to take? And so I think we had some great examples from our panelists this evening, but I think it's really important that we need to be accountable and hold each other accountable for that as well. So I want to thank you all so much. Gosh, Irene, Thelma, and Elena, thank you for sharing and providing, I think, such a wonderful perspective and giving us a good sense of the disparities that some of us may not see. And I think I appreciate you sharing that with us this evening. So it is just as another note, you know, we do have more coming up for Stand Against Racism this week, so please visit our website. There's actions to take every day, including tomorrow is Advocacy Day, which is dealing with infant mortality rates being the highest and for women of color Black women in particular. So there's real actions we can take as well in terms of the advocacy and legislative session we're in right now. So thank you all so much for being with us this evening. Have a wonderful night.
Gracias.
Thank you.
Thank you.